Wonderful. Well, thank you all so much for jumping right away into the chat. We want to welcome you for this Wednesday morning or mid-afternoon for our webinar. This is an Arizona Women Leading Government webinar series. And today it is the 1st of May, and we are putting a spotlight on Mental Health Awareness Month. This is just such an important topic that we wanted to be able to bring to light this month, and we're going to be hosting 2 webinar specials on it. The first one today is going beyond stress management. So we wanted to be able to really just be able to destigmatize the subject of mental health and give all of us a baseline tools for conversation and understanding about mental health awareness. We do want to put the caveat out there immediately that this is not going to be medical advice. We are not going to be trained professionals, but that this is going to be, again, just a way to start building the discussion, whether it's personally or within the workplace, and to really be able to, again, help bring light to something that has become such a prevalent issue within our communities and for a lot of us within ourselves. So with that, we will go ahead and get started. My name is Andrea Alicote. I am a board member with Arizona Women Leading Government and have the honor of being able to help bring some of these webinars to you. I work for the city of Mesa, and again, just an honor to be able to be here today. With me is Andrea Soroy. She is with the town of Oro Valley, and to give you a little bit of background on her, she holds a master's degree in public administration from the University of Arizona and has been working for 6 years in the public sector. She has volunteered her time on mental health advocacy projects by serving on a nonprofit board, facilitating, presenting, as well as training other facilitators for peer support groups. She currently works for the town of Oro Valley as an executive assistant, and in this past year became certified as a mental health first aid instructor, where the town is piloting a program to certify managers and supervisors in mental health first aid. So Andrea is going to be our featured speaker for today. Please, this will be an interactive session as well, so feel free to use the chat feature. And you are able to submit questions directly to myself and Andrea through the Q&A feature. So there will be several prompts along the way that as you feel open and willing, please go ahead and pop in your answers. And otherwise, we will save time at the end to be able to do a more thorough Q&A field. So with that, without further ado, Andrea, we are so excited to learn from you today and to help give us an introduction into this really important topic.
Thank you so much for the opportunity to be here, and thank you everyone for attending. I am very excited to be talking about mental health today. I'm just pulling up my screen to share. So just want to make sure that you guys are able to see the screen with the PowerPoint. Perfect. So my name's Andrea. I'm the executive assistant for the mayor, town council, and town manager over at the town of Oro Valley. I'm super excited because our work has really prioritized mental health in the workplace. And so being able to bring my personal passion to the workplace has been an incredible journey. Today, we're going to be talking about going beyond stress management tools. And a little bit about myself is I'm a peer. I've been diagnosed with bipolar 2 for about 5 years, and I've been managing my OCD since childhood. I became a mental health first aid instructor about 1 year ago. I am a board member for Beautiful Purpose, a bipolar community, for 2 years. I've been a peer support group facilitator for various nonprofits for 5 years. And then I'm a trainer program manager for Beautiful Purpose, a bipolar community peer support group for a year. And so I just want to shed light as someone with lived experience and, how I've brought my lived experience to the workplace and just being a resource to those around me. So as we go on to the next slide. Just to go over the webinar flow, we're going to do a self check-in. The asterisks are indicating that I'll be asking you to engage during the webinar. So if there's an asterisk there, I'll be asking you to use your chat feature. So we'll have a self check-in conversation about scope in terms of professional, personal, and self. The difference between wellness versus well-being, the 8 categories of wellness, the 5 elements of well-being, the impacts when organizations overlook well-being, a Be Well plan, some statistics and more about lived experiences, emergency safety plans, mental health in the workplace, and then we'll take a minute to zoom out as public servants to talk about mental health as policies that we see, and then a questions and answers section. So this first part is a self check-in, and I'm taking this from some of the mental health peer support groups that I facilitate. They're very similar to AA groups, if anyone's familiar, where people with lived experience come together to seek support for a set amount of time. Usually it's about an hour to an hour and a half in person or virtual. And we usually start off the meetings in the sort of fashion of, hello, my name's Andrea, and I have bipolar 2 and OCD. So this slideshow shows some of the questions and topics that are usually discussed in an individual's 3 to 5 minute introduction and check-in. And the questions include, how are you feeling in this moment? How has your week been going? Is there a topic or two you want to hear about? And so if you actually want to use the chat feature and answer any of these questions, I'd love to know how you're feeling in this moment, how your week's been going, if there's a topic or two you really want to hear about during this session, and hopefully we cover it, or we can get you answers or topics later. So please feel free to join the chat. Very busy. Feeling teary today. Tired. Grateful. Pretty smooth, thank goodness. Yes, that's always nice. Wants to hear about, I didn't realize there are support groups for bipolar. Yep, and I can get into more resources. Oh, hearing about those who hold mental health against you. Spread thin, pretty good. This is awesome. I really appreciate everyone's authentic answers and participation. Roller coaster. I hear that. How to remain hopeful, anxious, overwhelmed, annoyed. Well, thank you guys for sharing. I'll go into the next slide. So I just want to take a minute to acknowledge where I see my purpose and how it fits in professionally, personally, and self. And so I think a lot of us probably share similar purposes professionally. But professionally, I love placemaking, providing physical community spaces, safe places, quality services. I'm sure working in government, all of us probably feel similar, but I won't say with absolute certainty, but I certainly hope so. Me personally, I do a lot of volunteer work with mental health because I feel it's important to empower individuals to be in the right space to engage in their communities. It's great how much resources and assets we provide in our communities, but if individuals aren't in the right mind space or the ability to engage, then that makes it a challenge to really get people to the parks, or have them utilize our services, or even maybe come to town hall and ask for resources. And then with self, I prioritize myself. That way I can show up personally and professionally for others. And so this just is showing a little diagram of how I feel it's really all integrated and why it's so important for me and finding my purpose as I work on this both professionally and personally. I want to hop in and talk about wellness versus well-being. I feel like this is a really important topic. Oftentimes these verbiages are used interchangeably, but they are different. And so the wellness as a whole, according to the Global Wellness Institute, wellness is an active process that requires that awareness and action, which leads to a holistic approach, lifestyle changes or choices, whereas well-being can be static. It's that sense of well-being. And so wellness, there's a great diagram here, and I want to acknowledge that both are multi-dimensional, dynamic, very subjective and personal. And so wellness relates more to that intention, that action, that activity. It has a very prominent physical dimension. Consumers often associate it with products, lifestyle choices, marketing offerings. Common usage would be like wellness sector, wellness committees, whereas well-being is that perception or state of being, has a very prominent mental and emotional dimension. Citizens often associate it with feelings of satisfaction and sense of fulfillment. And then a common usage in terms of policy and government would be like a well-being budget. And then it's useful, it's a way to usefully gauge citizen welfare. So there's the Global Happiness Index, which relate to organizations and policies and intervention tools that really shows and demonstrates data on well-being. To hop in, there's 8 categories of wellness. And as we go through the slide, if you could think of one of the areas of the wellness category that you'd like to spend more attention and time on, I'll ask for you to use the chat box to give your examples of which one you'd like to spend more time and focus on. But to quickly review each of these, in terms of the 8 categories of wellness, emotional is that ability to successfully handle life stresses and adapt to changes during difficult times. I have examples of different activities and wellness techniques here. It is definitely not an exhaustive list, but in terms of emotional, what that could look like is self-compassion activities, self-awareness tools, self-soothing techniques. Environment is sustainable life for you, those around you and the planet. That could look like time spent outside, a clean house. Financial is that ability to comfortably pay for bills, invest in long-term investments, and address any unexpected expenses. And so financially, some activities could look like budgeting, savings, investment, debt management. And intellectual is activities that promote positive neuroplasticity and those brain changes, usually through intellectually stimulating challenges. Examples could look like reading, new language, new hobbies. Occupational is finding that harmony between work and other personal commitments and enjoyments and finding that right authentic balance. And that can look like taking breaks, vacations, using sick time as needed, and even investing in personal work styles and interests. There's a lot of different tools out there. Like one of my favorite is Clifton Strength Finders, and how to use your strengths to really harness the time that you are using at work, maybe finding out what times of the day that we're most productive and really focusing on those times, and there's different ways to show up professionally without hindering our mental health and making sure that we have that balance and harmony. There's that physical component within one of the 8 wellness categories. And the idea with that one is maintenance of the physical body to prevent illness and injury. And some examples is sleep, nutrition, flexibility and balance, and exercise. In this list, it's really interesting because I think flexibility is often overlooked and it's one of the pillars for physical fitness. And balance is a really interesting one because not only does it help prevent injuries, but it's actually overall an indicator in terms of physical health. Data has linked the inability to balance with higher rates of type 2 diabetes, cardiovascular diseases, unhealthy blood lipid levels, obesity, and other health complications. And so even when we talk about physical wellness, sometimes what we're focusing on isn't always where we can make the most impact. Exercise is obviously important too. So just finding what works best for each individual. Social, in terms of social, it's the ability to maintain positive and genuine relationships and effectively communicate with those around you. And what that can look like is spending time with pets, peer groups. So I know someone had mentioned peer groups, and there are so many resources, and we'll get into it in a bit, for different disorders, for different groups, and different nonprofits that offer them. That would be one example of social. Volunteering. And then spiritual is the eighth one, which is expanding a sense of purpose, typically tied to morals, ethics, values, and individualism. Examples could be travel, gratitude, and religion often comes up a lot when it comes to spiritual wellness. There is a quote, I'm not going to read the entire quote, but basically what it's saying is attention must be given to all 8 areas, and the neglect of one will adversely affect each of the other ones. But it's not equal time spent in all 8. It's finding that authentic balance and personal harmony. If you want to take a minute and just share, if you're comfortable, which of these 8 wellness categories would you say that you'd like to spend more time on or improve on? Physical, more time for exercise. Social, a bit of a hermit. Finding hobbies definitely adds to life. Physical, emotional, self-soothing. I know self-soothing is one area that I've worked at a lot, especially in terms of my OCD, and finding ways to cope. And so for those that may not be as familiar with self-soothing techniques, oftentimes it's heard with children in terms of finding self-soothing. But what it looks like for me is, instead of calling my friend and seeking support, is how can I find that support internally? I mean, it's still good to reach out. It's still good to have friends, but also just finding those ways to find healthy coping mechanisms and addressing my anxieties and stresses, and finding that positive way to have positive self-thoughts in the process. And I really appreciate your guys' patience. I'm obviously nervous, so thank you for your participation. It's definitely helping. Sleeping better, would like to sleep without interruption. Intellectual, spiritual, nutrition. Thank you guys. I appreciate the positive affirmations. Okay, well, I will continue on to the next slide. So the 5 elements of well-being. One is career well-being. Do you like what you do? Another one is social well-being. Do you feel like you have strong relationships and meaningful connections? Financial well-being. Do you feel financially secure? Physical well-being. Do you have the strength and energy to live your life the way you want? Community well-being. Do you feel connected to where you live and a sense of engagement? And so as we go through this slide, if there's one area of these 5 elements of well-being that you feel like you could improve on, where you could feel more satisfied in, feel free to share those. Which ones that, if you want to feel more satisfied at work or financially. For me lately, it's been a lot of financial. I've been working on trying to pay off some debts. And so I've had to really work and on techniques for financial well-being. And with this particular sense of well-being, I have that self-checking cloud, and really it's about self-awareness and doing those consistent assessments of how I'm feeling overall. And so it's one area of getting that to that sense of well-being. So career well-being, also a mental health first aider. That's awesome. Hopefully you find, you said you want to share your knowledge more. So I hope, bringing it to the workplace or other communities. I absolutely love the program for sure. And so kind of a diagram of what it looks like is, if you take the 8 categories of wellness, all of that could be going into a tunnel that produces the quality of life and satisfaction. And so oftentimes individuals focus on that wellness, and when the well-being's not there, it can actually have a negative effect overall. And so organizationally, what that looks like, overlooking well-being, is there's a Gallup survey, and they compared the 4% of adults that thrive in physical well-being alone versus adults that thrive in all 5 elements. And so I know there's a lot of initiatives that focus on wellness. I mean, we talk about how it can save organizations money with health premiums and the health plans for our employees. But when we look at just people who thrive physically in well-being alone, they're 68% more likely to miss more work each year due to poor health, which seems so conflicting, but still really interesting. They're 3 times more likely to file a workers' compensation claim, 5 times more likely to seek out a new employer in the next year, and twice as likely to actually change employers. And so while we could be saving money in some areas with wellness, by overlooking well-being, this could have other costs associated with productivity, worker satisfaction, and work culture. So quickly, I'm just gonna, I guess not too quickly, but we're gonna go into the Be Well plans. And so how to tie both wellness and well-being all together. And so I wanna acknowledge that this is just one tool. This is not the end all be all only way to incorporate wellness and well-being, but if it's helpful, here's one way that, that you can use this as a tool to bring changes or instill those positive lifestyle choices. So what I look at in terms of a Be Well plan, it's in terms of the wellness. If I'm assigning myself a category, say physically, then I assign an individual meaning to me. Like, what does it mean? What does it look like to have positive wellness in that area? The action to support that meaning, support in times of need. What can I do or who can I reach out to in order to still accomplish it? Phone a friend, I guess. And then self-compassion. How can I have self-compassion in the process? So I'm going to use the example of sleep. For me, sleep is one of the number one indicators for a bipolar episode in terms of a green light or a red light. If I'm not getting enough sleep, there is repercussions that happen. And so I really have to focus on good sleep hygiene. There's a meme on the side, and it's one of my favorite memes. And it says, my body gives me signals the entire day that it wants to sleep. Then I go to bed and my body says, well, now I'm not doing it. And I don't know if anyone else can relate to that, but I feel like it's me every night where I'm just like, I can't wait to get home and get into bed and relax. And then I'm up so late and not sleeping or relaxing. So 100% relate to that so many times. I'm glad I'm not the only one. And so when we're taking a look at this and applying sleep to it, I break it down, and my personal individual meaning when it comes to sleep is keeping sustainable energy and mood through regulating my sleep. And so that means really sticking to a bedtime routine and also aesthetics. That also helps me with the sleep hygiene. And so my personal action is getting excited about sleep, not just in the daytime, but also in the nighttime. So I have a whole sleep zone that's dedicated in sleep space, dedicated to getting excited about sleep. So it's inviting, it's welcoming. There's a calming light, a sunrise alarm clock with fancy noise features. I have books, Sudoku. I do a sleep transition where I get to bed about an hour and a half before I want to fall asleep. I cuddle with my dog. I have a good mattress and pillow. And so just trying to really get excited and give myself what I need in order to accomplish it. And then in terms of my support in times of need, when I'm consistently not making the mark, what I'll do is I'll set a bedtime alarm as a reminder of like, okay, now it's the time to start my sleep transition and get into bed. And then also sleeping meds, it's my last resort, just because for me, it throws me off for a few days. So sometimes I have to balance, you know, how much am I in an episode where I definitely need to take my sleeping meds because I'm not going to get any sleep? Or can I fall asleep naturally using my other techniques? But sleep meds would be one of my supports in times of need. And then self-compassion, just giving myself plenty of affirmation, even if I'm missing the mark. I mean, coffee also helps, but that's not necessarily the healthiest way. um, but then I also do continuous check-ins. And so that self check-in is that check-in for well-being and how I'm feeling. It can be over the course of a month, it can be 2 weeks, it can be daily. I have OCD, so I always try to be careful not to go too overboard where I'm tracking things so much on a daily basis where it's taking me away from my goals of really just being more self-aware and more satisfied. So it's finding that right balance of check-in. There's not necessarily a right or wrong answer. It's all individualized. But the question would be, how am I feeling about my well-being? In this case, it would be that physical health dimension, wellness dimension. And so do I have the strength and energy to live the life that I want? Am I getting enough sleep to show up at work or to be able to do those activities after work? So I want to give a few minutes if you guys want to work and taking the wellness area that you had mentioned, if you want to assign an individual meaning, an action, support, self-compassion. And then overall, we can talk about, that self-checking and well-being. You can use the chat. So if you want to throw in, people had mentioned sleep as well. Some people had mentioned exercising. If you feel comfortable mentioning what that means to you, some activities or actions that you would take in order to accomplish it, some support examples if you're needing help and support in the process, or self-compassion quotes. So I'll give you guys a few minutes. I know it's a lot of information. Thank you for sharing your diagnosis. I really appreciate that. And you mentioned sleep is important, but also eating and taking time to eat. Um, yeah, and dieting can lead to more mental health issues if you're not finding that right balance. And it's interesting because in mental health first aid, they talk about different mental health disorders and challenges, and they have a category on eating disorders. And so there's a lot of stats and statistics, and I had no idea. You don't know what you don't know. And so I learned so much when it came to eating disorders and some of the root causes and why, and things that are helpful to say, unhelpful to say. My routine is not used my phone or TV before going to sleep. Yeah, turning off the electronics. I'm not great about that. My mom and I, we always play Words with Friends in the evening time, and so sometimes I always have my phone on, and but I always say it's social, right? Like the social well-being and connecting, having quiet time to meditate, not getting enough time with family, or too much time. Yeah, finding the right balance and setting boundaries. Yeah, boundaries come up a lot in general in terms of different groups where I participate in peer support groups. Sharing knowledge on mental health means I can be comfortable sharing it and it's okay to talk about it. Offering support by listening, resources. Self-compassion. Self-compassion is hard. I know I was talking to someone today and we were talking about how hard sometimes it is to take compliments. And what I found is mindful pause has helped me instead of saying, oh, no, like that wasn't that great, or no, and instead of deflecting or saying like, okay, yeah, that was all on them. They did the great job, which is good to give affirmation, but also when it is really truly your work, and accepting those compliments. Sometimes that mindful pause has helped me. So if I can't get to the point of saying thank you, even just mindful pause, so I'm not deflecting or not, acknowledging it. Setting aside time to work out for 3 days a week. Getting schedules for local gyms. Yeah, our community center at work, we have fitness schedules and courses, and so I always go there because we get classes for free. So I hang up my the schedule for the community center so that I'm more likely to look at it and sign up for a class. I'm also a social exerciser, so finding a buddy to go with me. And it's totally okay to miss a day. Doesn't mean you failed. Awesome. Okay. Well, oh, recently had a family move. That is hard. Yeah, spending more time outside with dogs and sketching and yeah, just finding those ways to really feel connected again. And especially, when we're talking about emotional and adapting to life's changes, it's so hard moving and feeling disconnected. So going into the next category, I really want to acknowledge, how important it is in terms of having a Be Well plan. But I would be remiss if I didn't acknowledge hurdles and struggles that people often have due to mental health challenges. And this slide is focused on how prevalent mental health challenges are. So these statistics come from the National Alliance on Mental Illness. They have great resources. They have a lot of peer support groups. So if you ever need resources, they're a great place to start. But some of the stats they have is 1 in 5 adults experience mental health illnesses each year. 1 in 20 US adults experience a serious mental illness each year. 1 in 6 youth, which is age 6 to 17, experience a mental health disorder each year. And one of the most interesting statistics, for me at least, is 50% of all lifetime mental illnesses begin by the age of 15 and 75% by the age of 24. And so a lot of the time by 24 years old, 75 of the percent of the population has already experienced a mental health challenge. But that also means that 25% may face that at another time, and we may not be aware of, where they're at in that spectrum. So first, acknowledging again, peer support groups, recovery groups, connection groups, all of those are interchangeable terms for peer support groups. They're for those who are diagnosed with illnesses that are seeking support and have lived experiences. I put a slide here of common themes that come up in these peer support groups since I've been, training and facilitating for the past 5 years. Some of those topics include handling shame and guilt, whether that's about the diagnosis or about challenges surrounding mental health challenges. How to find hope. I know that was brought up in the chat. Loneliness, sleep. Sleep comes up so often. Hygiene, managing triggers, medicine management, finding the right medical team, how to support others with mental health challenges, FMLA, work accommodations, disability benefits. And so I want to give an example of guilt and shame. For me personally, it didn't happen just once, but one of the more prominent times was right before I was diagnosed with bipolar. I had been misdiagnosed and mismedicated, which caused a mental health crisis. And I was working through a hypomanic and manic episode for 2 months, and it eventually escalated to psychosis. And I had no self-awareness of what was happening and that it was escalating. And I had no idea what was going on internally with me. And my perception was that I was kicking butt at work. Like I thought I was on top of it. I thought I was doing a great job. That was not the case at all. And now having the knowledge and the self-reflection and the new perspective, I'm actually really embarrassed of that time when I worked for a different city and town. And that city and town supported me. They, granted me short-term disability. They asked me how they could support me with, with the new diagnosis and those types of things. But I didn't have the knowledge or understanding yet to know what I needed or to still know what was going on. Even just because you have a diagnosis doesn't mean the knowledge suddenly gets there. And sometimes I think back to that and I still have some shame and guilt around it. It's also funny because in one of the peer support groups, someone mentioned when we were talking about how to support others with mental health challenges that you can't bring a horse to you can bring a horse to water, but you can't make them drink in terms of supporting loved ones. And my comment back was, and sometimes we don't even know we're a horse. And that was totally me. Depending on where someone is in their journey, they may not have that ability. They may not know that they're supposed to be drinking water right now, and they may not know how to vocalize it. And so, having that compassion in the process. I also want to acknowledge one other thought that's often brought up, and I've had a lot of peers that feel similar, and it's this notion of not being sick enough for the mental health world and being too sick for the normal world. And I haven't found the perfect way to phrase that. But I feel like that notion is really rooted into a lot of the stigmas, causing this in-betweenness, because oftentimes people think of mental health challenges as very dichotomous state when truly it's a spectrum. And oftentimes I've heard, you know, peers say how oftentimes people feel they should present in certain ways, or that people assume we're having trouble in some areas of our life versus other areas. And so, those are things that often perpetuate some of the silences, some of the stigmas, because of the concerns about, I'm not enough, or I'm not, presenting in the way that people would assume I am, or they're presenting fine and they may be in a much different place. So one area where we can support friends, family, and self is emergency safety plans. And I just want to acknowledge this because it's one way of, addressing crisis situations, is having an emergency safety plan. The idea is if you or someone aren't in the place to articulate needs and what your preferences, needs, or ways of support, then there is an emergency plan that you or someone can go to reference. And so items on a safety plan could be emergency contacts, it could be hospital preferences, it could be doctors with contact info, current medications, food allergies, childcare, pet care, to-go bags, and any sort of triggers that could escalate the situation, like touching, yelling. And so for me, sometimes it's really grounding to go through, my emergency safety plan and feeling empowered that if, by the time I get through my emergency safety plan, if I'm still not in the right mind space, then it is a choice to go seek help and go get help in a way that I might need it. I also work really closely with our HR department in terms of mental health in the workplace. And I want to give an example of what that looked like recently. And I received permission to share this story and the level of detail that I'm about to share. But someone I know experienced her son's mental health crisis. And now this person has other family members that have other health crises going on. So this is not the only one she's facing. And I'm going to mention age because as we were talking, she had said, I was not expecting at 73 years old for my son, who's 40-ish, to have a mental health crisis. I was prepared in so many ways for these other crises that I'm dealing with in my personal life, but I didn't account for this one. And now she's dealing with some of the aftermath, legal, law ramifications, lifestyle changes, and just overall large changes. She mentioned to me in conversation of feeling overwhelmed, and who wouldn't be? And feeling close to a meltdown. So with her willingness and permission, I provided these points to her as a resource to use at her own discretion. And she let me know, she followed up later, that she created an emergency safety plan. She kept a copy, gave her a copy to her emergency contact in the event that she may need help as she's helping others. And to wrap up the story, I also gave her NAMI's local family to family group support link. So if she wanted to connect to other families who may be in similar situations, then she has that as a resource. And then also provided her EAP information. I also asked if she was comfortable if I let our HR department know in the event her son shows up and staff's aware of the necessary details of the situation, and only the necessary details of the situation. And I really just want to acknowledge her bravery for feeling comfortable enough for me to disclose this and share this in a webinar and in the mental health first aid workshops, trusting myself and the HR department to handle sensitive situations, and then her courage just for and bravery for sharing in general. And I don't want to go into too much detail about how I've responded to different, non-crisis, escalating and crisis situations, because each one I have is so different. But it lends well to my next topic, which it's like I planned it that way, but how to bring mental health conversations to the workplace. And so for the town of Oro Valley, the way that we've brought it to the workplace is through a mental health first aid program. And mental health first aid is kind of like being a lifeguard. Those are what the icons are in the bottom left corner. It's seeing if somebody is swimming fine, if they're maybe struggling, but they're getting to that wall, they're struggling and needing support, or they're drowning and they need immediate intervention. And so it's just that constant assessing, and then what can we do to help them at whatever stage they're in. And it's really interesting. Another statistic is even when people finally seek help, a delay of 10 years or more is not unusual, which causes serious consequences to a person's life, limiting their social, occupational opportunities, increasing risk for depression, drug and alcohol disorders. And so if we use that stat in the beginning where, 50% of all individuals, 50% of people with mental health illnesses have a challenge by the age of 15. And then if they have a delay of 10 years or more, that vital time between 15 to 25, what all is being affected by the time that from between when they've experienced it to when they're getting help. And so these are ways of closing that gap and getting tools to people sooner. So the two ways in terms of mental health first aid that people can bring it to their workplace is on the right, there's a link to getting trained in mental health first aid. Anyone can sign up for a class online. The classes vary depending on who is providing it or starting a program. And so at the town of Oro Valley, I launched a program where I became a certified instructor. And we're providing trainings this May to our executive leadership team, our directors, and our senior management team. And then in July, we're launching it townwide to any interested employees to help have these conversations at all levels in government. And what it covers is common signs and symptoms of mental health issues, substance use challenges, how to interact with a person in crisis and non-crisis situations, and how to connect them with help. I'm not going to get into the meat of this because we have a webinar on May 15th that covers, the programmatic, the hows of it. So I just wanted to briefly mention it. This is a picture of the soft launch where some of my coworkers volunteered to be my first mental health first aiders. And so I really appreciate the support that I've had at all levels in this process. So this one's open for the chat, but what does your place of work do to support mental health? Some examples is employee assistance programs, public safety peer support programs. I know there's also some non-public safety peer support programs, which we're going to get into on May 15th as well. Flexible work schedules, health coaches, wellness committees, employee-centered spaces, employee events. So feel free to use the chat if you're aware of other tools that your workplace has. And I'm just looking at the chat as you guys are typing. Is there an upcoming webinar more designed for directors, supervisors implementing the programs? I would say it's definitely worth tuning in May 15th for some more examples of programs and also how for these programs and the project managers and how they got it, the buy-in. We have a wellness program and we have been invited to take, sorry, there's a lot of comments, which is awesome. invited to take mental health first aid classes, relaxation rooms, employee assistance programs, health counseling sessions, wellness programs, employee events, 2 times per month, a meditation. Health coaches for each department, so you could reach out to people you might not know. And at the town of Oro Valley, we have a wellness committee, and our health coach sits in on the wellness committee with the different departments. Yes, and ACMA as well has some stuff coming up. Flexibility, yes, definitely. And thank you guys for sharing. I do want to take a minute to zoom out in a larger government context as public servants and policymakers. And while some of these may be examples of policies at state or federal level, these very much have an effect, whether it's an effect on our employees, effect in our communities, effect on us personally. And so one example in terms of the government context that I'll share is when I had moved out to Maine. And when I first got there, I went to renew my driver's license, and I was filling out the form. And on the form, it had a checkbox, and it said, if you experience things like Alzheimer's, dementia, epilepsy, bipolar schizophrenia, check this box. And being a rule follower, I checked the box. And this whole new series of events then had to happen. So I wasn't able to get my driver's license renewed that day. I actually had to have a psychiatrist sign off on my ability to drive. And so having just moved to Maine, there was a 3-month waiting period to get in to see psychiatrist. And then in addition to that 3-month period, when we're talking about medicine, they wouldn't even prescribe medication on the first visit. So I doubt that they would have been able to feel comfortable enough to sign off on my ability to drive. And so, it was very daunting thinking about job hunting. Like, how am I going to secure a job if I can't have a driver's license and I can't drive? How am I going to get food and groceries? And it was rural Maine, so there was no public transportation. And so, that it was just such a different experience that I hadn't anticipated. And so when I had done research, it roots back to a 1962 medical review process. And when I was looking online, I was just seeing, if people experience this in other states. And this isn't research, so grain of salt, but based on different blogs and things that I had seen, some people experience this in Florida and Texas and California and Maine and Virginia. And so it's not just a weird one-off isolated case. These have impacts on people that we may or may not know. Another interesting one is the California Bill 43 about conservatorships. It was signed into law on January 1st, 2024. And except for 2 counties, they're actually going to delay it by at least 1 year. But the idea is that it expands the definition of gravely disabled for public conservatorships in terms of eligibility and also involuntary holds. And so now it also includes people who are unable to provide for their personal safety, necessary medical care, in addition to food, clothing, shelter, due to severe substance use or serious mental health illness. And this one's really controversial. Originally, back in 1967, there's an act that was made in order to really define what qualifies individuals as being able to be involuntarily held. And so this is the first time that they've expanded it. And so there's a lot of different reactions to this. That 1967 was a direct result of some of the human rights violations we saw with mental asylums of the 50s and 60s, and people, sometimes forced into mental health centers. And so now Californians who experience serious mental health or severe substance use, or most at risk for harming themselves, can have a public conservator appointed to direct their care. It's also very controversial when we're looking at current events with celebrities. We have the Britney Spears and Amanda Bynes in terms of their conservatorships. But it also brought questions about resource availability in terms of, while more people may qualify, are we investing in prioritizing in community-based interventions? Are the resources there to support this? And then questions as a whole around involuntary holds. So it'll be interesting to see if other states, change any of their laws or what that looks like in California. Another example is temporary Medicare changes for telehealth post-COVID-19. We saw a lot of changes during COVID-19 in terms of telehealth. And so currently it's not required for an in-person visit within 6 months of an initial behavioral or mental health service or annually thereafter. So anyone can, use telehealth services. Medicare patients can receive telehealth services in their homes, and then telehealth services can be provided by all eligible Medicare providers. And these are temporary changes that are set to expire December 31st, 2024. So what that means is that it will then be required for a person within 6 months of an initial behavioral or mental health service and annually thereafter to have an in-person visit. Medicare patients may not be able to receive telehealth services in their house. Telehealth services may not be provided by all eligible Medicare providers. And some stats about Medicare is about 1 in 4 Medicare beneficiaries live with mental illnesses, but only about 40 to 50% receive treatments. In 2005 and 2006, or 2005 to 2006, about 74% of psychiatrists accepted Medicare compared to 55% in 2009 to 2010. And then we've just seen downward trends since then. And I don't know the answer in terms of cities and specific demographics in terms of, how many citizens are on Medicare, but these are examples of how they can affect our residents and our communities. So I want to open it up to questions and answers. And these are kind of some guidelines and peer support groups that we use in order to keep, positive questions and answers and discussions. So please just keep in mind that this isn't from a healthcare perspective and I'm not a trained medical professional. And then some topics can be triggering. So just being careful what we share. And then please know if I can't answer your question today, then I'll happily provide follow-up answers.
Thank you so much, Andrea. Oh my goodness, this has been just such a wonderful and insightful hour of really being able, I think, for all of us to take that moment, to be able to learn and educate, but also to create this safe space community to really be able to share. Thank you all so much for participating in the chat kind of prompts and things. We are coming close to our line here, but I did catch a question that was within the chat earlier on. And this might be putting you on the spot, Andrea, but when you had the slide from NAMI, it had listed severe mental illness, and the question came through of what is considered part of that severe mental illness category.
Yeah, so in terms of the statistic, and I can go back to that slide too, I don't want to misrepresent, wrong slide, because it's probably most likely based on the DSM-5, which is in terms of in terms of a medical category. I do note that severe, like bipolar, for instance, is categorized as a severe mental health. But I don't have enough knowledge on the spot to be able to articulate what would qualify, what wouldn't qualify, but I'd be happy to look it up.
Wonderful. And that, I think, then really points to this discussion was, again, the baseline discussion to our next webinar, which will be in exactly 2 weeks. We hope I will put that link in the chat. So that way then you can sign up. I know the question came through on if the next webinar, which is going to be investing in our people, prioritizing mental health in the workplace. What we plan to do is have a panel of 4 municipalities that will share some of their innovative programming While it is intended to be for, maybe project managers or those that can advocate for different types of programming within their agency, I think as we had learned here today, there's something all of us can learn, and I think it helps also be able to provide more tools and phraseology even to be able to have these types of discussions in the workplace. So I think a lot of what we wanted to amplify with Arizona Women Leading Government on the topic of mental health awareness is really being able to make it an accessible topic, whether in the workplace, giving us tools to be better stewards within our community, in providing public service. And so a lot of that is really, again, just making these types of conversations a lot more normal and frequent. And so even if you are not somebody that is in a position to be able to maybe make those programs happen, we still hope that you were able to join us in 2 weeks. So that way, then again, we can all just become more of the stewards of this information and being able to create these safe environments within our workplace. And then, so and to say that, we're going to be then hearing more specifically on the program that Andrea had mentioned that she had started within Oro Valley. She will be back as one of our panelists. So I do have some questions that we will save then for that next time to be given to her and our panelists as well. Just that way we can make sure that we have that broader conversation. And then finally, just to wrap up, if you can please make sure we just sent out membership renewal information for Arizona Women Leading Government. If you like webinars and programming like this, please be sure to renew your membership or to sign up. Make sure that you are on our email blast. Our next email newsletter will be coming out in June, in which we will be publicly announcing the next conference dates and location, which are highly anticipated throughout the year. And again, we just look forward to being able to bring so much more of this to you. We actually just had a board retreat yesterday in which we have the next year planned out of really robust content. So looking forward to just continuing to amplify Arizona Women Leading Government and the great group of women that we have to surround ourselves with. So thank you so much, Andrea. We could not be more grateful for your time and expertise today. And I just hope you go back and look at all of the warm sentiments that you received in the chat. You did a phenomenal job with us here today.
Thank
Thank
you.
you so much for joining us.
And I just want to acknowledge really quickly that not only do I appreciate everyone who's here today, but wherever you've been or wherever you may be, I'm glad you're still with us. And if you or anyone you know is in crisis or needs a crisis line, I put a link at the bottom of the right. So feel free to reach out if you need any sort of resources. And thank you for having me. I really appreciate this opportunity.
Wonderful. Thank you so much for those final thoughts and sentiments. And again, we hope to see you all back here in 2 weeks. Thank you so much.